Good afternoon, I'm Dr. Robert Mitchell. Today we're going to be going through what it takes to prepare a subcutaneous testosterone injection. Displayed today are syringes. All of these things you should have received in your order from Kraft. Syringes, these needles are specific for loading the testosterone, which I'll show you how to do that. This is an injection needle, which is a lot shorter and it's smaller in terms of its gauge or diameter, so it's a little easier, friendlier for the skin. And alcohol swabs. You should receive your testosterone in a box that's similar to this. Depending on the drug manufacturer, it could be a little different. And this is the vial of testosterone itself. So for today's demonstration, again, we're going to prepare a syringe with a dose of medication, which when you receive your order, you should see it written as to how much you're supposed to inject and how frequently. Today we're going to prepare a 0.5 milliliter injection for a subcutaneous injection. And so let's get started. It's always a good idea to wash your hands prior to prepping your injection, and I've done so let's get started. For most of you, you're going to receive 1 cc syringes, and this is a 1 cc syringe. It's calibrated. This is 0.1 all the way up to 1.0 mils. And we're going to get started over here by loading the needle. This is our loading needle. It's an 18 gauge needle. You will appreciate the fact that it's not a terribly long needle, but the gauge is quite specific and sensitive to being able to get the medication into the syringe. And before we load this, it's important when you receive your medication, your vial of testosterone will come sealed with a cap from the manufacturer. You just pop that off. And for each time that you load this medication, I'd like for you to clean it with an alcohol swab. Alcohol swabs will be provided in your medication kit. And so we're just cleaning the surface of this plunger. Now, once that is prepped and ready to load the syringe, what I like to do is draw up about 0.2 cc's of air before placing the needle into the syringe. So once that's in the plunger, I want you to turn the vial upside down so all of the medication is here. Push the air into the syringe. And then while looking at the calibrated part of the syringe, we're going to pull this plunger back and you can see the medication loading into the syringe now. And this is the 0.5 that we wish to load for this particular injection dose, but we see that we have some air here, so I would like for you to push past that. So we're at 0.7. So I just kind of tap on this. The air is all located at the top of this syringe in this position. We're going to push this back into the vial until we are exactly at 0.5 mils. Remove this. Now I'd like for you to recap this loading needle. Removing that, putting that to the side. Now, your injection needle, this is typically for most patients going to be a 25 gauge needle, but only 5/8 inch in length. And this is the needle that we prefer for a subcutaneous injection. So now that this is loaded, we did so in a sterile environment. This, so that you can see, is calibrated at 0.5 mils. This is 5/8 inch needle in a pretty small diameter or gauge. And now this is suitable and ready for a subcutaneous injection.